Healthcare Exposed with S.R. Ridley, a nurse you can trust.
Welcome back to Truth Hour of Healthcare Exposed. I'm S.R. Ridley, a nurse you can trust. For those of you all who are returning, thank you so much. And for those of you who are tuning in for the very first time, please don't forget to click that button, like, share, subscribe, and comment. Now, we've been together now for a while, and we've talked about various topics. However, today's topic is titled, Today's Nurse Practitioner is a Joke. Now, you may be saying, S.R. Ridley, you're being a little harsh. No. So what is a nurse practitioner? A nurse practitioner traditionally is a nurse who went to nursing school and somehow accumulated 4 years of nursing, whether it was straight as a baccalaureate degree or whether it was a 2-year degree and then they continued on to get your bachelor's of science of nursing, and then they moved on to do, and remember this term, advanced practice degree. So now that you know what a nurse practitioner is, and then before they went to nursing school, and this is the part that I want you to pay attention to because this is the most crucial part, the nurse usually had 5 to 10 years of experience in their particular discipline or specialty that they're going to be a nurse practitioner in. The Board of Nursing used to, and I say used to, make it mandatory for you to have 5 years in a specialty. So if I wanted to be a critical care nurse practitioner, I would have to have 5 years of ICU critical care nursing experience before I could even go to nurse practitioner school. So what has happened? Well, you see, come a little closer. Healthcare thinks that you are not intelligent. They believe that when you come into the emergency room, we're going to deal with the emergency room, that you don't have a clue and they can do to you whatever they choose to do. So let's get back to the nurse practitioner. Now remember the term, advanced practice nurse. Today's new nurse practitioner, not the traditional ones who had 5 years or more experience before matriculating or going to nurse practitioner school at the master's or doctoral level. Do you know that the Board of Nursing now makes it so that you can walk out of nursing school, graduate from nursing school, and just step right into a doctorate program to become a nurse practitioner without ever taking care of a patient in a hospital? Are you kidding me? So why is that important? Why do you have to work as a nurse, or why should you work as a nurse in a specialty before you become an advanced practice nurse? Well, not only do they lack experience, they have no experience. So when you go to nurse practitioner school, let's back up. When you go to nursing school just gives you a Snapchat view of what nursing is. You don't really spend a lot of time in the different disciplines. When you become a nurse practitioner, you have 550 or 600 hours that you have to do in a concentrated area because that's your specialty. When they come out of school, they're put on the line of being equated to almost to a physician. In some states, in 23 states, nurse practitioners can practice without the supervision of a physician. Now remember, today's new nurse practitioner walked straight from nursing school, never entered a hospital, never laid hands on a patient as a licensed practical nurse, and now they're supposed to be an advanced practice nurse. Now they're supposed to be making doctorate-like decisions based upon you. And you thought you were getting something special, and you realize you're not getting anything. It's just like an M&M, a peanut M&M with no peanut inside. Yeah. True story. You know I'm always filled with true stories. True story. A 32-year-old Caucasian man walks into this rich hospital and he is complaining of chest pain. So we think he could be having a heart attack. When you come into the emergency room complaining of chest pain, we have to rule out heart attack. Well, the nurse practitioner assumed care of him. True story, I can't make this stuff up. So normally, when you come into a hospital, especially at his age, 32, and you're complaining of chest pain right here in the center, you're a little sweaty, you have these things that we do for you, okay? We draw your blood, we do a chest x-ray, we may give you some medication as we put the IV in your arm. Now here's the thing. We draw a lab, and that lab is called a troponin, right here. The American Society of Cardiology states that you're supposed to draw one troponin and then you're supposed to draw another one 3 hours later. Why? Sometimes that first troponin can come back negative or it could come back elevated. The most important thing is we need to see if the number is rising. Now, I'm going to tell you what this nurse practitioner did. This young man came in complaining of chest pain. She drew one lab specimen. Now, that protein that we check for in your blood, it has 3 components that we test for. She tested for one. She tested for a troponin. You see, he could have had an upper respiratory infection. He could have had a cold. He could have had the flu. He could have had a urinary tract infection. He could have had pneumonia. She didn't do a chest x-ray. After she did one test, she didn't repeat the test as she was supposed to do. That young man was in and out of the emergency room in record time. Now you sit back saying, oh, that's great, because who wants to be in the emergency room for a long period of time? But what I'm telling you is that is totally dangerous. That young man left still having chest pain. We did not do, or she did not do all that she was supposed to do. Now, she was your new nurse practitioner today. Your new nurse practitioner. The nurse practitioner that do nothing nurse practitioners. So, I just want to say, and I'm going to say this a couple of times, right? If they dumb down the requirements and they dumb down the experience, and they dumb down the training, then what are you truly getting in today's new nurse practitioner? The new nurse practitioner that goes to nursing school, leaves nursing school, goes straight to get their doctorate degree, and never ever has any bedside experience. Now let's contrast that with your physician. So they go 4 years of undergraduate, then they go to medical school. The last 3 or 4 years, they start to put hands on patients, okay? Then they come out and they do 3 to 4 years where they put their hands on patients, where they are able to make decisions and diagnose you. Now, I want you to look at all of that hands-on experience. 3rd year, 4th year medical school, an additional 3 to 4 years. You are talking almost 6 to 7 years of hands-on experience. And then you couple that with the new nurse practitioner today, who has like almost 0 experience being taught with hands-on experience. This is who they have taking care of you, your loved one, your daughter, your mama, your sister, your brother. Don't you want your nurse practitioner to be intelligent, have some experience, know what they're doing? Another true story. In this faith-based hospital, they have a rule that if you come to the emergency room and you are seen by a nurse practitioner or a PA, that if you come back within 30 days complaining of the exact same symptom, you must be seen by a physician. Now, I'm not saying that there aren't good nurse practitioners. All I'm saying is that you need to, in chapter 3, go to the back of the book and you need to read the bottom line. And you need to ask your providers these questions because your life matters. You need to ask the nurse practitioner what type of nurse she was before she became a nurse practitioner. Asking that one question just might save your life. If he or she says, oh, well, I really didn't practice too much at the bedside, I just kept going to school, run. You are now in danger. I am seeing these new nurse practitioners write the wrong medications on the wrong patients for the wrong things. I am seeing patients just unethically being misdiagnosed. I was in the lift today, and my car broke down. And the young man said, SR Ridley, I don't want to know. I said, you don't want to be proactive? You don't want me to educate you so that you can be safe? And he said, no. And I know there are going to be lots of you out there who just would rather not know, but understand that not knowing means that it could just harm you. Or don't you owe it to your children or to your mom, your sister to know all you can to be safe? Remember, as my good friend Charlie W. once said, he said, there's no reset button on life. You only get one. These nurse practitioners, they have to be trained appropriately. Go back to the emergency room. Now, we've had multiple shows where we talked about the most dangerous nurses in the emergency room, the new graduate nurse and the float nurse. Run to the nearest exit. But now let's look at the whole emergency room. If you have new nurses, new docs, and new nurse practitioners and new physician assistants, who teaches who? Now you have a whole conglomerate of the blind leading the blind. And that's why when we get to this book and when we get to the episode where we talk about things like sepsis protocol kills and why your children are getting the wrong medication right in front of your face. I know it's safer to not know, right? But it's not safer to not know. You need to know. These nurse practitioners are called advanced practice nurses. Advanced practice nurses. So if you're going to be an advanced practice nurse, shouldn't you advance from something? If you advance from nothing, what does that make you? Incompetent. So when you go in the emergency room, when you go to your doctor's office, when you go to places where nurse practitioners are housed, I need you to ask that question. What type of nurse were you before you became a nurse practitioner, and where did you practice? Because if he or she can't tell you, you are in danger. I mean, you are dangerous. Run. Ask for another provider. It's your right. In every facility, they must give you your patient rights. Most hospitals have listed on the wall what your patient rights are. Value them, acknowledge them, keep them with you, snap a picture. Because those rights may just save your life. A message to all the nurses, and especially the ones who want to become nurse practitioners. Just because they say you can doesn't mean you should. As nurses, we owe it to you. And as healthcare professionals, we owe it to you to give you our best. See, as a patient, when you enter today's emergency room, you are not supposed to be at your best. However, as healthcare professionals, we are always supposed to be at our best. I was on Twitter recently and I made a statement, and one of the nurses made a statement back, and I never believe that there's ever a reason for you to be mean to a patient. Never. I don't ascribe to that at all, under no circumstances, I promise you. And the young person said to me, well, sometimes as nurses, we have to be firm and we have to tell people, and here's a tweet. We have to tell people that if they need to put the chicken away, they need to put the chicken away. And what I told the person was, there's always a way to talk to people. There's always a way to talk to people. So the same way I'm talking to you now and I'm trying to find a way to reach you so that you can stay safe. You know, we as healthcare professionals, we have to take the right tone for you, because if we're speaking to you in a degrading, debasing way, we're not going to reach you. And I do believe it's part of every healthcare professional's job to teach and educate, because where do you learn this stuff? The school nurses have dumbed down and shackled the role of the school nurse to the point where he or she can't do anything. They can't even give a Tylenol out. What a shame. They have to call you, the parent, at home to come get your child because they have a headache. They can't even give it. They can't even give emotional or Tylenol. Now, you need nurse practitioners with experience. If they're going to be put on the same level, and if they're going to provide safe health care for you, you have to have nurse practitioners with experience. When they have no experience, they are truly a danger to you. So once again, you must ask those questions. Remember, a nurse practitioner, the first word is called advance. They must advance from something. Now, we haven't spoken about the physician assistants, okay? But we're going to do a show about the PA, and I talk about it in this book, the book that saved millions. Are you safe in today's ERs? 10 things you need to know that will save your life. We're going to do a show because I want you to know that all PAs that practice this particular way are illegal. Listen to me. And this is for the lawyers. I want the lawyers to take this. This is my gift to you. Chapter 11 is a lawyer's dream. All PAs in the United States that practice this way, the way that we're going to talk about in the next show, they are practicing beyond their scope, and everything they do to you is illegal. So what if they make a mistake? What if your loved one dies? They were never licensed to do what they were supposed to do. And you remember the show where I told you that I polled 175 baccalaureate nurses, and I asked them what governs their license, what determines their scope of practice. And only one knew that it was the Nurse Practice Act, the state Nurse Practice Act, the law. Now, the PAs know that they're practicing illegally. And I plan to get a whole lot of feedback with this, but when you have a PA, and if that PA is practicing a certain way that we're going to talk about in another show, they are extremely illegal. So you have an illegal PA, and then you have an inexperienced, unintelligent, incompetent nurse practitioner. Who do you choose? You choose you. You choose life. You choose life. At the end of this episode, in the bottom link, there's going to be 2-minute Health Tip Tuesday. And 2-minute Health Tip Tuesday is going to give you true health tips that you can use right now in your life, because I realize there's so many people enter the healthcare system, and I hear this one slogan all the time. No one ever told me. I never knew. I've been healthy all my life until I came to the hospital. Remember, parts of your body you only get one of, you want to treasure. You only get one brain, one heart. You get 2 feet, but who wants one? Anyway, we're going to wrap this up again and say, today's new nurse practitioner is a joke. Thank you. I'm SR Ridley, a nurse you can trust. And don't forget to hit that button and subscribe, share, comment, and like. And you put a question at the bottom. Do you want safe health care? Thank you.
Thank you, and see you next Wednesday for Truth Hour, Healthcare Exposed. And don't forget to click that button now and subscribe, comment, share, and like. And then I, SR Ridley, a nurse you can trust, want you to get mad and hashtag My Life Matters and let healthcare know that you are not going to take it anymore. Because in healthcare, all lives matter. Are you safe in today's ERs? Next Wednesday.